This shows the acceptance of ancient Chinese medicine before the Nara period in Japan. The first recorded medical books in Japan are Yaoshu and Mintantu. The former is a book on medical herbs, and the latter covers acupuncture and moxibustion. The first formal system of medical study was established in 701, when the Taiho Code was implemented. During that time, many medical books had already been imported from China. In the Heian period, the most remarkable medical book was Isshinpo, which was written by Yasuyori Tamba. This book is the oldest existing medical book in Japan and includes content from medical books that no longer exist in China. From Isshinpo, we are able to gain knowledge of parts of the content of the lost medical books. In the 16th century, many doctors accepted Rishu medicine. Dosang Manase, who was called the restorer of Japanese medicine, was born in this period. His best-known book is Keitekishu, which is based on the theory of yin, yang, and the 5 elements, and he added the knowledge he had gained through his own practical experience. The school of thought described in his book was called Gosei School. The Koho school of Japanese traditional medicine was first adopted in the late Edo period. Todo Yoshimasu proposed the theory of a single poison, that is, disease is caused by only one poison, and treatment of disease is performed by expulsion of that poison. He denied the theory of yin-yang and the 5 elements. He also developed the criteria for abdominal diagnosis for selecting Kampo prescriptions. A compromise between Kampo and Western medicine was subsequently advocated. Seishu Hanaoka, who believed in this method, was the first doctor in the world to operate on a patient with breast cancer using parenteral anesthesia in 1805. He used a Kampo prescription for the anesthesia, which included thorn apple. The 3 key characteristics of Kampo medicine are shown here. The first is the systemization of abdominal diagnosis. 2 famous books on the diagnosis of abdominal conditions are Fukushou Kiran by Bunrei Inaba and Fukushou Kiran-yoku by Shukuko Wakuda. This figure shows the abdominal indications for the administration of Daiken Chuto, which include intermittent peristalsis of the intestine. Daiken Chuto is administered to patients with abdominal pain following abnormal bowel movement, and the Kampo formula is also most frequently used for preventing ileus after abdominal surgery. The second is the guiding principle of adhering to the composition of the original prescription according to Kampo methodology. The proportions of medicinal plants in the original prescription should remain unaltered for each individual patient, different from the case in China and Korea. We treat various clinical conditions by administering different Kampo prescriptions rather than by changing their formulation. The third is the invention by Waichi Sugiyama of a guide tube that is used to aid needle insertion using the acupuncture technique. This guide tube is slightly shorter than the needle, hence the latter can be inserted easily and painlessly by pushing it through the former. In 1895, the Meiji government adopted a policy for elimination of Kampo at the 8th Assembly of the Japanese Diet. Thereafter, Kampo practice declined drastically. However, it persisted in private practice until it was finally rediscovered by mainstream medical practitioners, largely due to the influence of some major works of literature, including Kokan Igaku by Kyushin Yumoto. In this book, He attempted to explain Kampo medicine from the perspective of Western medicine. Subsequently, Kampo has been entirely reinstated in modern medical care, following the considerable efforts of dedicated adherents such as Keisetsu Otsuka, Shiro Hosono, and Domei Yakazu.